Good morning, welcome back. Today we'll study about Hydatid disease. It occurs due to the Echinococcus granulosus and Echinococcus multilocularis, and it occurs throughout the world. And it emphasizes the global nature of the problem. It's a cosmopolitan parasite and has at least size genetically distinct strains, two of which are relevant to human infection. Okay, there are many types of Echinococcus granulosus, but two are main strains which causes the infection to the human. So the causative agent is larval stage of tapeworm of dogs or sheeps. Okay, tapeworm, and the mode of transmission is through dust, grass, or dirt. That is environmental transmission to the hands of the person and his mouth. Again, from dog hair to hand, it may spread. And the clinical manifestation includes the majority of the cysts which are formed will not show any symptoms. Usually, the clinical features include organ will be involved, and the site of organs will be involved wherever the infection is present, and it will be depending on the stage of cyst development and the viability of the cyst content, what the cyst contains. Okay, based on this, the features included. The symptom of disease are related to expanding mass pressure on adjacent structure and function, infection, and rupture of cyst contents into surrounding body cavities. It is kind of the tumor. Okay, when the cyst grows, it put pressure on the adjacent structures or adjacent organs, and it will disrupt the functions of the surrounding organs. And if the cyst burst out, it will give out the contents and it will cause the infection to the nearby organs. Uncomplicated liver cyst usually present with a dull ache in right upper quadrant or a feeling of abdominal pain and distension. Okay. If there is any liver cyst which is uncomplicated, but it will show slight pain over the upper quadrant region or feeling of the abdominal pain and the distension. On clinical examination, enlarged liver with a rounded mass is felt on its surface. Okay, when you palpate, you can feel it. A large cyst in the hilar region can compress the common hepatic duct, causing the cholestasis. Okay, in the hepatic duct, when there is a large cyst, it will put pressure on this duct, and the coli will be whatever the produced col will be stayed there itself. That is called cholestasis. Okay, and the hepatic vein compression or inferior vena cava compression can cause Budd-Chiari syndrome. An infected Hydatid cyst has clinical features of liver abscess. If there is any hepatic vein compression or inferior vena cava compress, it will show the symptoms such as Budd-Chiari syndrome, and the infected Hydatid cyst will show same features as liver abscess. Okay. The pressure symptom of large cyst in lungs are cough, hemoptysis, chest pain, and dyspnea. Okay, these are the four main symptoms which is caused due to the cyst present in the lungs. Okay, and the rupture of cyst contents in the pleural cavity may cause allergic reactions, including anaphylactic reactions, pleural effusion, pleural implantation, and empyema. Okay, these are the four conditions or a complication due to the rupture of the cyst in the lung. And the involvement of other organ may cause the soft tissue fluctuant swelling, that is called muscle cyst, raised intracranial pressure, and focal epilepsy in case of cerebral cyst. If there is a cyst present in the brain, that's called cerebral cyst, it may cause the intracranial pressure increase and the focal epilepsy. And the segmental portal hypertension in case of splenic cyst. If there is a cyst present in the spleen, it may cause the portal hypertension because this organ is a one which is involved in the portal portal circulation. And the acute pancreatitis and jaundice in pancreatic cyst. Again, if there is a cyst present in the pancreas, it may cause the acute pancreatitis infection and jaundice. If there is any cyst in the bone, it may cause the bone pain, swelling, and pathological fracture. And again, if there is a cardiac cyst, that is a cyst in the heart, it may cause the pericardial effusion or pericardial tamponade. And if again it is there in the kidney, then it may cause the local pain and loin pain and the hematuria. In the orbital cyst, it may cause unilateral exophthalmos and blindness. That is in the eye region. If there is any cyst, it may cause unilateral exophthalmos and blindness. And diagnosis can be done through the serological test and MRI, magnetic resonance imaging, ultrasound, and CT scanning. Okay, these are the four diagnostic features which may show the presence of the cyst in the body. So how you can prevent? That is, first one, through the identification and treatment of cases. The cases having Hydatid cyst should be investigated and proper treatment is required. It can be diagnosed through the CT scan or MRI. Soon after the diagnosing, you should start the treatment, that is albendazole. 10 to 15 mg per kg can be given, and it's a 3-month course with an interval of 14 days. Recent studies have shown that uninterrupted drug therapy for 3 to 6 months have better efficacy with no increase in adverse effects. Other drugs used are mebendazole and the praziquantel. Okay, these are the two other drugs which can be used in replacing the albendazole. In the 3 to 6 month course, there was no adverse effects were found. There is one more technique, that is called pair technique, where puncture, aspiration, installation, and installation of solicidal agents can be used for the percutaneous drainage of hepatic hydatid cyst. Okay, you're puncturing, aspirating, whatever the content is there. Again, you are installing the solicidal agents, and the percutaneous drainage of hepatic hydatid cyst can be done. It's a treatment of choice in patient with hepatic hydatid cyst who refuse surgery or having comorbid disease, that is associated disease, and treatment option for cystic hydatid disease remain the surgery. Okay, surgery has the potential to remove cyst and leads to complete cure. In if you are not agreeing for the surgery, then you can go for the pair technique. Next one is deworming all the dogs. All the dogs who have eaten uncooked sheep's internal organs should be dewormed so that it will not transfer the infections. Next, disposal of dead sheep and sheep viscera. There should be adequate disposal of dead sheep and sheep viscera so that dogs are unable to eat them. And eliminate stray dogs. Stray dogs should be eliminated from the community. Make sure that dogs do not defecate in and around the children's play area. Otherwise, it will transfer the infection to the child's body. And the last one is the hand washing. Wash the hands after handling or playing with the dogs. Proper hand washing can prevent many of the diseases. So, wash your hands properly. So, and here I will stop the class, that is hydatid disease. We'll see in the next chapter. Thank you.